I'd like to call the Human Services Committee meeting to order and welcome those live streaming this morning. First item of business is the declaration of pecuniary interest. Hearing none, information items. And I want to welcome Tanya. This is her first opportunity as the acting director. So like I always say to the newbies, ask lots of questions. All right, information items. Item A, 2018 homeless enumeration attached.
Thank you, Mr. Chair. I'm happy to welcome Hart Walker here today. He's our PhD candidate that we hired as a consultant to assist with the homeless enumeration, and he is going to present the report on the results in Bruce County.
Welcome, Hart. And also there's a little red button there if you want to push that. Perfect.
Thank you. So, good morning, everyone. I'd like to thank Tanya Dixon for inviting me to speak here today, and thank you for allowing me to speak about the results of this study. So my name is Hart Walker. I'm a PhD candidate in the Department of Sociology at York University. I was hired temporarily by the county to complete, to coordinate the enumeration back in April, which took place between April 23rd and April 27th of this year. And we'll see if this works. Okay. The enumeration was the result of legislation that was passed by the provincial government back in 2016, legislation called the Promoting Affordable Housing Act. And what this did was it mandated, for the first time in Canadian history, actually, it mandated all the municipalities of the province of Ontario to complete a homeless count every 2 years. So this was the first such count that was done in Bruce County, and it was the first that was done in many other municipalities as well. And this legislation was also part of their initiative to end chronic homelessness by 2025. The results will also aid in helping outline an updated version of Bruce County's long-term affordable housing strategy. So just to speak quickly a little bit about rural homelessness in general, this is what I'm writing my dissertation on. So it's a relatively new area of study in general, particularly in the last decade. A lot of studies have been done showing that that homelessness is just as prevalent in rural areas. It's usually something that's been associated just with urban areas in the past. But a lot of research is showing now that, unbeknownst to many people, that it's also prevalent in many rural areas of Canada. There hasn't been enough research to really determine the extent and the dynamics of the issue, so it's still a very growing area of research. What we found when we did the enumeration was that the people experiencing homelessness here in Bruce County come from a very diverse number of groups. So it's a very socially diverse population. And also data collected by both the counties, Bruce and Grey counties, has shown that people who are at risk of homelessness is rising in the area. So the methodology that we used is called a period prevalence count. What's normally used in urban areas, they call it a point in time or a PIT count, and this is a count that's done over a 24-hour period. However, in rural areas, because the population is much smaller and tends to be a lot more spread out, and there aren't the same public transportation options that people have in urban areas, the period prevalence count extends the count over a longer period of time. It's generally over the course of 1 week. And what we did was we had people positioned at different hub sites, so different organizations at various parts of both Bruce and Grey counties. And it was organizations where we knew that people experiencing homelessness would go to access services. And so we had people positioned there to ask people if they could conduct a short survey during that week. So in the total in both Bruce and Grey counties together was about 50 people we counted that week, so an average of about 10 new people per day accessing services who said that they were experiencing homelessness. In Bruce County alone, there was a total of 17. 11 of those 17 people agreed to complete the survey and 6 did not. So the procedure when someone declined to fill out the survey, they were simply counted as experiencing homelessness. So I'll just go through the results here. There's a few tables. So we took the most salient results of the study. So the first was the type of housing that people were currently using who claim they were experiencing homelessness. So the largest category was people living in motels or hotels. Because Bruce County doesn't have an emergency shelter, that's my understanding is that that's generally the procedure is to place people who are in need of emergency housing in motels. So that was the largest number. A couple of people did not know, stated that they didn't know where they would be going that evening. Another 2 people said they were in a sort of lost my train of thought there. Couch surfing. So 2 people said that they were staying with a friend or family, which is something we usually refer to as couch surfing. And then there was 1 person who was in an undisclosed location. The age was a really interesting finding. By far, most of the respondents were under the age were 31 or under, which suggests that youth homelessness specifically could possibly be an issue or a growing issue in the county. The gender of the participants was roughly 2/3 male and about 1/3 female. Racialized identity, so the ethnic background of the participants, same, actually very similar to gender. 2/3 were white and another 1/3 were reported an Indigenous or Métis background. And then finally, regarding health issues that were reported, mental health was definitely the most often reported health issue. Some of these overlap, so participants often cited more than one type of health issue. But mental health was the most often reported, and then that was followed by people with addictions, as well as chronic or acute physical issues, and then the last category was physical issue of some kind. So that's the quick version of the report. As we were conducting the study, since this was the first time, we were very closely following the procedure that was outlined by the province. However, we did notice certain limitations to the study as we were conducting it. One of them being that it didn't have measures to allow an accurate estimate of the homelessness population. So we counted 50 people, but how close that is to the actual number of homeless people in both Bruce and Grey counties is still unknown. However, the results were enough to show that this is a major socioeconomic issue in this area, and has given us enough data to suggest further studies that we can pursue in the future. Thank you.
Good, thank you very much for your presentation, very informative. I will open it up to the committee for any questions or comments. Janice?
Thank you. Thanks for the presentation. How did you come up with these people to survey them? How did you track them down?
So so what we would do is we had people positioned at the various hub sites that I mentioned earlier. So those were organizations where people who are experiencing homelessness generally come to access services, like to find emergency housing or access mental health services. So we had people who were trained. We held a training session a couple of weeks prior to the count where we trained employees of these organizations to conduct this survey. So if someone came in who one of those employees knew or suspected was experiencing homelessness, they would simply ask them and say, would you like to fill out a short survey? And then they were given a care package that included some supplies and a Tim Hortons gift card as well. And so it was sort of just letting people access the services and then asking if they wanted to fill out the survey.
So if these people aren't seeking any kind of assistance from any of these organizations, they're flying right under the radar?
Correct.
Because I'm under the impression that we have close to a dozen in my municipality alone.
And most of the people I spoke with afterwards were surprised that the number wasn't higher, that the final count. And this is something that it's actually referred to in the research literature as hidden homelessness, which is a particular kind of homelessness that's prevalent in rural areas in particular, because it's much easier in those areas for certain individuals to go under the radar, so to speak. But that's something that requires further investigation, I think. It also, another thing I was going to quickly mention is that it depends on the perception sometimes as well, because sometimes these individuals, they might have a different take on what homelessness is. So someone who has no other place to go but a friend or a family member's couch to sleep on might not consider themselves homeless. We had people turn down the survey for that reason. They said, oh no, well I have a place to stay, I'm sleeping on so-and-so's couch, so I'm not homeless. So that's another thing that is tricky about the count, is that it's hard to get an accurate count when there are people who might be in a very precarious housing situation, but they still don't consider themselves part of that group. So.
Any other questions or comments? Dan?
Just a question with respect to the rate of homelessness. How does this compare to urban areas? And I wondered if there are other similarities, differences between urban areas.
Yes, so there are many differences, definitely. Like we were talking about, access to services certainly being one of them. It's something that definitely warrants further study, but there are a few things in particular that stand out when looking at rural homelessness that aren't necessarily the case. One big one that I've seen in the research and that people working in the counties mention frequently is transportation. There is no public transportation, and so people have a more difficult time accessing services, and so they might decide not to access them for that reason. There's also different economic reasons between both urban and rural homelessness. For example, the fall, it tends to take, rural communities it takes them longer to spring back just in general from economic problems so there isn't the same availability of employment necessarily as there is in urban areas. So that's certainly an issue as well.
I was wondering specifically, if you could comment on the rate of homelessness. If you've identified 11 and maybe it's double that or more per 65,000 people in Bruce County, how does that compare to an urban area of hundreds of thousands of people?
So we can't really draw conclusions like that from this particular study. However, there was a large study that was published last year by the Rural Institute of Ontario in Guelph. And there's actually, if anyone's interested, I can send you this information. They actually compare the different rates of homelessness. And they're actually very surprisingly similar. So there are much fewer people, of course, in rural areas because there are fewer people there to begin with. But in terms of the percentage of the population that's experiencing homelessness, urban and rural is actually virtually the same.
And with respect to some of the other statistics that you've put together here, percentages of different ethnicity, or whether or not they've been a part of the not the adoption system, but the what's the word I'm looking for? Well, just the statistics that you compared here, the breakdowns, the pie charts, those sort of percentages, are those percentages similar in urban areas as well?
That's very difficult to say. It's actually, if you took this study alone, it's really impossible to say, and this is one of the things I didn't go into detail about, but regarding the limitations of this particular study, is that if we don't have measures in place to estimate what the size of the population actually is, then it's impossible to determine how much these particular percentages actually represent the actual population that's out there. So we can't, it wouldn't be, it wouldn't give us any accurate information to compare these particular percentages to the sort of general statistics that are out there. Does that make sense?
Well, I guess what I would understand to happen over time with these studies taking place across the province is that we'll begin to be able to improve the research methods as well as compare these things across the province and across different areas so that strategies can be put in place to direct them. So I guess I understand that it's in the early stages and there's weaknesses in the research, but I just wondered where the similarities were in terms of the breakdowns, because then perhaps the solutions begin to be a little bit similar and maybe just adapted to our rural area.
Mm-hmm. Thank you.
Good. Any other questions? Paul?
Just out of curiosity, how would you determine, you had, I think, 17 from Bruce County, but how did you, what criteria did they, if you're homeless standing in Owen Sound, are you from Grey County, are you from Owen Sound, or from Tara, did you hitchhike in, like, what, was that where they were schooled prior to becoming homeless? What criteria gave them that they were able to say, well, no, I'm from Bruce County?
Yeah, so again, this was a particular measure that we realized was a shortcoming of the provincial guidelines. It was difficult for us to gauge that, and because another characteristic of the homeless population is that they often are very transient. So they will come sometimes from urban areas, even if they can't find anything, say in Toronto, then they'll come back up this way, hoping that they'll be able to find something. So what we did was we collected the amount of time that person had been homeless, and then we asked them essentially, how long have you been in this area? And in many instances, it was people who had formerly lived here, but became homeless for whatever reason. And so most of the people we asked, I would say at least 2/3 of the people we asked were from either Bruce or Grey County originally, but had fallen on difficult circumstances. So we did ask them which area they were from and what length of time they had been in the area.
Anne?
The statistic that kind of interests me was the foster care. And maybe that's an area that's easier to research, because I've always thought it's difficult for young people in foster care. All of a sudden they're out of foster care and they're more or less on their own. And so your statistic there that 45, I know this is just one study, but I think that's where more research needs to be done, and it would be easier to nail down. Like, you know, you can research and research and research in an area, but sometimes you have to get more specific. And I think that would be a good area to research and see if there's other areas in Ontario or follow-up studies validate that. You know, because adulthood is a more difficult transition these days.
Yes.
When foster care was set up. Anyway, that's just...
No, that's actually a very good observation. I completely agree with that. Most people who experience homelessness whether they're from an urban or rural area, have experienced family difficulties and family fractures and, sometimes abuse as well. That's something that in the research, as well as talking to service providers, has shown that that's almost a universal theme among people experiencing homelessness, is that they're often, not always, but are often have come from a situation like that. So I completely agree that that's a very important area of future research for sure.
I think it gives more concrete path when you are, if, as you say, there's more evidence of that than just this study. And so often in research, research is great, but I think you have to land on, you can't do everything at once, and if you have indications, then you have a path forward, and then what can you do about it, and actually get to the action point. So that's,
Yeah, and that's what, well, at least the way that I look at research and that many other people do, is that it acts as a guide to sort of point you in the right direction in terms of what services might be needed in the area and what those services should look like. So
how to identify the people, like you say, in rural areas, they fly under the radar. How to identify them more quickly and get action going. I'd like to see action.
Yeah, we all would, I think.
Good, okay, very thoughtful presentation, a lot of good questions, and keep up the good research, and we look forward to some conclusions, and hopefully at the end of the day that we don't have anybody homeless in Bruce County. So thanks again.
Thank you very much.
Okay, next information item, item B, 2018 Child Care Service Agreement. There you go.
Thank you, Mr. Chair. The information report in front of you is for the 2018 Child Care Service Agreement Amendment. In August, we received notification from the Ministry of Education that the Year 2 expansion plan had been decreased by $80,262. And the 2018 amended Child Care Service Agreement will be brought forward to committee for authorization when we receive it.
So that is for information. Is there any questions or comments? Hearing none. Moving on to the early on transformation.
Thank you again. This is the early on transformation report. Again, it's for information. So in 2016, we got information from the Ministry of Education to transform the Ontario Early Years Child and Family Centres into early on centres, providing a range of services to support children 0 to 6, their families and their caregivers. So when the needs assessment was conducted and working to develop an initial plan for local services.
So again, that's for information. Is there any questions or comments on that report? Dan?
Maybe just a comment on behalf of the municipality of Brockton and Brockton Council that, and the people within Brockton, that it's been observed that that's moving away from Brockton, and it's a significant service of young families, and we have a very much a growing population of young families. I think our kindergartens, early education programs are over capacity at this point. That's just an example of the importance of this program. So we would very much like to work with the county to identify a location and property within Brockton that would be suitable for this service.
Christine?
Sure. Thank you. Through you, Chair. I'll just update you. So Council, earlier today, there was the communication from Brockton, and it has been referred to Human Services Committee. So staff will work on a report and bring that back for the October Human Services Committee. For clarification, early on services are continuing to be provided in Walkerton and in other parts of Brockton, including Mildmay as well too. So the reference is to the actual physical site that is held at Bruce Lee Haven, which that site has moved. But again, for clarity, services continue in Walkerton.
Okay, thank you. Anything else? Okay, need a mover and seconder to ratify these proceedings. Moved by Ann, seconded by Mike. Any further discussions? All those in favor? Opposed, if any? That's carried. Thank you. Motion to adjourn. Milt, Janice. All those in favor? Opposed, if any? That's carried.